So we're just I think it's important for us to kind of get a context of, first of all, why reproductive justice is important as a framework that we're even thinking about using or applying to this particular situation around criminalizing pregnant mothers. And then to give you a little brief history to further talk more about what Lynn was talking about in the panel that was prior. So first, I think it's important that you understand what reproductive justice is. So the definition that for reproductive justice is every woman has the human right to decide if and when she's going to have a baby and the conditions under which she will give birth. Also deciding if she will not have a baby and her options for preventing or ending that pregnancy. And then finally, that she has the right to parent the children that she already has with the necessary social supports in safe environments and healthy communities without fear of violence from individuals or the government. And just to kind of bring that to where we are right now, individuals or the government in this particular context is the district attorney's office and the legislature. Okay, so I think we want to be very clear about who it is that we're talking about when we're talking about who is inflicting harm on pregnant women and pregnant mothers in Tennessee. I also think it's really important that we discuss what the political climate of the state of Tennessee is, so that you get a little bit more understanding of why this has become a dangerous trend of highlighting and targeting women, period, and then mothers, and then mothers of color, and then poor mothers, and then rural mothers, and then rural mothers of color. I think it's very important that we kind of get a little bit more of an understanding of the context of who is actually being impacted and at the level that they're going to be impacted. So the Tennessee has a supermajority that is Republican. Our governor is Republican. The majority of our legislators are white, Southern evangelical male legislators. Even though, we have as far as this law is concerned, it's had bipartisan support. And however, those views on both sides of the aisle have been quite conservative. Our black legislators are mostly conservative Christians here in the state of Tennessee. When I go places and I talk about the state of Tennessee and even talk about kind of what the context is as far as race and ethnicity here, I always say we have three races in the state of Tennessee: black, white, and Christian. Okay. So you understand what we're working with. And just to be clear, I'm a Christian, but I think it's really important to understand the lens in which our legislation is being placed or put down in the community. And in the 2014 election was an election year, a gubernatorial election, as a matter of fact. And then we also have a host of shaming and blaming legislation with a context of women or sex-targeted legislation. Now that since this past legislative session, we have a series of trap laws that have been introduced and things of that nature that restrict women's access to safe and legal abortion. Other legislation is Amendment 1, which we all fought last year, which would change the Tennessee Constitution around abortion provisions for women. Amendment 2, giving the Tennessee legislator power to confirm or reject state judicial appointments for Tennessee Supreme Court judges. And then the drug usage survey and testing prior to receiving public aid benefits. Also, abstinence-only sex education that was made law in 2012, which basically means that no young people in the state of Tennessee can receive any information or education that is anything other than an abstinence-based context. And then we didn't expand Medicaid. We don't have the Affordable Care Act here, and unfortunately, thousands upon thousands of Tennesseans have no health care, myself included. We failed to pass also Insure Tennessee, which was Governor Haslam's attempt, I think, to supplant the piece around whether or not we received health care, what our health care would look like, but that also did not pass. And so unfortunately, poor working Tennesseans as well as poor Tennesseans with no employment, unfortunately, do not have health care. And I believe that where we are with that is close to 400,000, maybe more than that. And then I think it's also important for us to talk about the fact that Tennessee houses the largest prison corporation in the country. Okay, so understanding the context of where we are and the ways in which our state supports the criminal justice system. Now I'm gonna look back because I think I'm getting a little old, and I don't know that I can. This is a timeline basically of what has happened with the law. And let me stand up because I can't really see here. So basically, this gives you a timeline from when the law began, whether it was the Safe Harbor Act, to our current legislation, on into where we are now with the current pregnancy criminalization law, timeline of the fetal assault law, timeline as well. You're 41 now, okay. And so we thought it was also important then to have a reproductive justice strategy in how we try to address this whole situation around the fetal assault law. So national allies required reproductive justice leadership to fight SB 1391. Ourselves and Young Women United, who have also done some amazing work in New Mexico around pregnancy criminalization as well, were asked to be a part of what the messaging strategy would look like, as well as help to be messengers around this, because we recognize that the persons who would be most impacted, as we said, were poor women, women of color, poor rural women, and in the reproductive justice world, we believe that the people who are most affected need to be at the center and lead the discussion around what it looks like when policies impact our lives. And then reproductive justice was identified as the winning strategy, of course. We produced messaging that would be inclusive of women who would be most impacted and what would resonate with multiple audiences, which is, of course, the right to parent, which is a reproductive justice value, and then mothers being forced to have abortions to avoid jail time was something that we wanted to lift up. Again, if a woman, has the right to parent, we don't want to place doctors in a position to police their bodies so that they would actually go and have abortions for wanted pregnancies to avoid having to go to prison, because we have a failed system that is not supporting them to get the type of health care that they need in order to address the issues that they're facing. And then doctors being positioned to police their bodies, causing mistrust with patients. And when we talk about the Black community in particular, we already have a mistrust with the medical community because of the long history and the ways in which our bodies have been used and abused by the medical community. So then to place a law like this in effect, which impacts, and especially when we're talking about the city of Memphis, who has over 60% African American population, that's a dangerous statistic that's a dangerous situation that we're putting ourselves into by even further exacerbating the mistrust that Black women in particularly have with their medical providers. Also building cross-sectional support with the HIV community, faith communities, academia, abortion supporters, media allies, and even the anti-abortion community, who also, when it came down to this particular issue, we were on the same side for a change. That it was important not to place women in prison or use jail as a way to stop women from using drugs, as if, her being sober, she wakes up one day and, I just would like to be a drug addict today, and as if that's the ways in which folks live throughout the world. And so then there was a sign-on letter that we all created together and an online petition. And then we tried to saturate the media outlets, and even up to this point, the Director of Healthy and Free Tennessee, Allison Glass, is still trying to be and get as much media attention around this as we possibly can to still lift up the ways that this law impacts mothers and their families. And so I think it's important also, even for you who are thinking about this in your own states, that you think about what type of messaging strategy that you'll use. For us, these were some of the top pieces that we use as far as the messaging strategy. Criminalizing pregnant mothers is a threat to the health and well-being of Tennessee babies with women and families, right? So low-income women, especially those from communities of color, have the fewest resources to navigate the course and keep their families together. And I kind of want to put a pause right here and give you a little bit of a story of a woman, the first African-American woman, who was the second woman arrested in the state of Tennessee, who was impacted by this law, which was Jamila Falls. Jamila Falls lives in Memphis, Tennessee. and Jamila Falls had been struggling with drug addiction for quite some time. She found out that she was pregnant. She did not have health care. I think it's important for us to lift up. What she did do, though, was try to find somewhere that she could get treatment while she was pregnant. The issue, though, is that there was nowhere for her to go. Ms. Falls went through the program. She ended up turning herself in. She realized that she was pregnant. Once she delivered the baby, she left because she knew that she was going to be arrested and was on the run for 21 days. And she finally turned herself in after 21 days and was put into a program. Well, and before she was even put into a program, she was incarcerated and held for 10 days. And understanding that if you know, those of you who work with folks who struggle with drug dependency understand that no treatment at all, no access, for some people could mean death, right? And in this case, this woman was pregnant, okay, or had just delivered. So she was already on the run, had no postnatal care, afraid for her life, afraid for her child. She had no type of access to her baby. She left because she was trying to make sure that she would not be arrested. Then after she was arrested, she was held for 10 days without any type of medical treatment. And then when she was then sentenced to her term to do the drug mandated program, which, let's be very clear, is not a real program, because she was sent to a detox center for 28 days. And then after the 28-day detox center, she was sent to a halfway house where she was then expected to get a job, and then she was expected to live her life and go through the program. What the woman said on the video was that she went to group, and that she had individual counseling, and that she had methadone. That's all she said she had. I'm not really sure that that's supposed to be considered a program, but that's what she said she had, okay? When Ms. Falls was not able then to pay the rent to stay at the halfway house, she turned herself into drug court and said, I can't do this, so just put me in jail. So right now, she's serving a term of 3 years in the prison here in Tennessee, okay? So this is what happens to poor women. This is what happens to poor, marginalized women, whatever race, but poor women don't have the resources to navigate the court systems. She didn't want to have them come get her, and so she turned herself in. But I'm saying now she's in jail, and so does that mean that she's going to get some type of drug treatment in jail? Okay. And so then the next piece, the families with the least amount of support are going to be torn apart, not strengthened. The other issue for us as a reproductive justice issue is the fact that women who, most women are already mothers. Okay, and because they're already mothers, what is supposed to happen to their children? Ms. Falls, for example, she didn't have the type of necessary social supports where somebody in her family could take her child. Her child is now a ward of the state. Okay, and for Black and brown women, it's harder for us to get our children back because we cannot navigate these court systems, because we do not have the resources in order to do so more than not. Okay, then desperate women may have unwanted abortions for pregnancies to avoid arrest or losing custody of older children. So there's the issue around custody, and then there's the issue around her feeling forced or her back up against the wall then to have an abortion for wanted children. And that's what, in light of the fact that we have an anti-abortion billboard campaign in Memphis right now, basically demonizing Black women for not wanting our babies. Okay? So that's not the issue, more than not, with Black women or women of color or poor women. So then the next piece, addiction is an illness. Pregnant women struggling with addiction need access to prenatal care and not jail time. So addiction is worsened by poverty. I say it again, addiction is worsened by poverty and lack of opportunity to resources for daily living. Okay? So this law isn't targeting a woman who's also possibly using heroin, but she has a job and she can access her private healthcare physician. Private healthcare physicians aren't being held to the same task as public healthcare facilities. So mostly Black and brown women, poor rural white women, poor whoever, are going to public health clinics, are going to the county hospital. This is basically, as far as we're concerned, where they're being preyed upon, right? Because they're more vulnerable, okay? And so then criminalizing pregnant mothers is a cost burden to taxpayers. So putting children in foster care and then estranging them from their parents is not only expensive, but it can create worse mental health outcomes and further unraveling marginalized communities. We still don't know what the effects of this law will mean for Jamila Falls, nor her baby. We still don't know what this law is going to mean for poor women who have been impacted by this law. The first woman who was impacted and was arrested was in East Tennessee. Her bail was set at $2,000. and she could not afford the $200 to get out of prison. That's what we're talking about when we're talking about the ways in which this oppresses women of color, and for women, this is the issue for us and why this is a reproductive justice issue. So then there was medical messaging strategy, of course, that National Advocates for Pregnant Women, and Farrah will talk more about that. Some of the work that they did in order to lift up these issues around newborns not being born addicted, even though that was the new media message. That long-term implications for offsprings were misrepresented, that neonatal abstinence syndrome, when it occurs, was treatable. And that the media misinformation was stigmatizing, and it was characterizations were discouraging federally recommended treatment. Okay? So these are some of the strategies that we've been able to use. And unfortunately, despite the fact that so many of our medical associations around the country, as well as us having media coverage both domestically and internationally, we're trying to lift up these issues around whether or not women were, around the fact that this was a dangerous piece of legislation, our governor signed this into law. We realized that this was going to be a law where to try to seek out women who were comfortable to reveal their stories. And unfortunately, that is a very hard task, as we can see even this morning, where we don't have a woman who is going to come and share her story. And for the very real reasons that go on in women's lives, and especially women who are dealing with poverty, especially women who are constantly struggling back and forth with addiction. This person is also a mother. These are the conditions of, it's even hard for us to be able to get women to speak on behalf of themselves, to be empowered to talk about the ways in which they've been impacted by the law, whether or not it was a safe harbor law before this law passed, even up until this current moment. And then to continue a communication strategy, whether we're on social media, interviewing, op-eds, and etc., to try to create a toolkit for public defenders, which we have been able to successfully do, to document those punitive conditions under which mothers are criminalized and transition into treatment, or in the Juno Falls case, transition back into the criminal justice system. And then to document mothers' experiences under the new law. Even though we thought it was quite interesting that there's been a set of focus groups that district attorneys, the district attorneys across the state have been given in order to talk about how they feel that the law is working, but nothing to the women who've actually been impacted about the law, by the law, to see the ways in which is actually helping them to be clean, stay clean, get their babies back. And the other issue is also there has been no plan of action that we've seen that women are actually going to be able to get their babies back, and nothing stating that for sure that their records would be expunged after this was over, okay? And so, trying to repeal the law or file a lawsuit against the state of Tennessee, meet with the district attorney's office to try to advocate and try to reason with the DA's office, and then also trying to seek out funding to continue to undergird the work that is actually going to take to try to undo this. We're not really 100% sure that once the law sunsets that it's not going to continue, that there won't be some other provision put in place that will continue this law.